and development. Now, we've had a number of dialogues in this country, the dialogue on media freedoms, galamsey, childhood cancers, sugar in our drinks, and so on. Today, I'm very pleased that we are going to have an important talk on prostate cancer. This program is being streamed live on the Ministry of Health social media portals and the GIZ portals as well. We will receive keynote presentations and then have, importantly, panel discussions. I will invite Reverend Dennis Awiti. He is the Executive Secretary of the Pharmaceutical Society of Ghana to lead us in an opening prayer.
Let's bow down our hearts as we look to God in a word of prayer. Heavenly Father, we are eternally grateful to you for the gift of life. You give us the life, and it is your desire that we live healthily and we live fruitfully on the earth. As we meet in this dialogue on the theme bridging the gap in prostate cancer care in Ghana, it's our prayer that you give us wisdom, that we go through faithful deliberations and discussions, that when we live here with tangible proposals that will not only bridge the gap, but make prostate cancer care accessible and affordable, so that our health can be improved. We thank you and we bless you in Jesus' name. Amen.
Thank you, Reverend, for the opening prayer. Right, so before we proceed, I'd like to introduce myself. My name is Dr. Jeffrey Ofori-Brikon. I'm a specialist surgeon with special interest in prostate cancer care. I'm a urologist in training with the Kolego Teaching Hospital, and I will steer most of the affairs of today's national dialogue. I'd like to acknowledge a few dignitaries who are here present. As and when the others come in, we will acknowledge them duly. We have here Ni Adi Kwaku the Fifth, Otupia Adonte Manche. Shall we say thank you very much for honoring our invitation? And we have Na Koko Ajoyi the First Adabraka Manye. Thank you very much for making it here. And we have Na Adole Ablade the First, the Simpa Newtown Shukura. Very well. Then we have Na Tesaki Sabo the Third La Manye. Thank you very much for coming. And we have Dr. Darius Osei. He's a technical advisor to the Minister of Health. Dr. Darius, thank you very much for making us here today. We have Reverend Dr. Emmanuel Ahmed. He's a senior pastor, Christian Council of Ghana. Thank you, sir. We have Sheikh Aremeyao Shaibu, the spokesperson for National Chief Imam. Thank you very much, sir. And our own Mr. KSM, Kweku Sintim Bisa, is also here with us. Thank you very much, sir. Dr. Ifwa Komi, she's the NCD Program Manager for the Ghana Health Service. Thank you, sir. And Mrs. Mabel Kisua Asapo, she's the Acting Director, Health Promotion, Ghana Health Service. Thank you very much for being here. Mr. Benjamin Nyakuche, representing Mrs. Emma Oforiajiman, the Director of EPME with the Ministry of Health. Thank you very much. Professor Akwesi Tope is the Dean, University of Ghana, School of Public Health. Thank you, sir. We have Benjamin Weafi Kisi. He is with the Ministry of Finance. All right. Then we have Dr. Ruby Mensah. She's the Acting Director, Strategic Health Purchasing with the National Health Insurance Authority. Thank you very much. Then finally, we have Dr. Esiedu Bequin. He's the Director, Public Health, Ghana Health Service. Thank you, Dr. Bequin. Very well. So, next on our agenda, we are going to receive the opening remarks by Dr. Darius Osei. He's the Technical Advisor to the Minister of Health.
Honorable Deputy Minister for Professor James Nessa, Chairperson, Representative of Parliament Select Committee on Health, Rep of the Chief Director, Ministry of Finance, Directors of Ministry of Health and Health of Agencies, representative of CSOs and NGOs in health sector stakeholders present, distinguished religious leaders, friends from the media, ladies and gentlemen, good morning and warm welcome to each and every one of you. It is my honor to welcome you today. National Prostrate Cancer Dialogue, a very important platform, hoping to address prostate cancer as one of the most significant public health issues affecting men in our country. From what the experts are telling us, prostate cancer is the commonest cancer reported in men in Ghana, particularly in men aged 40 years and above. Like other non-communicable diseases, the burden that prostate cancer imposes on individuals, families, and other healthcare systems is immense. Yet, this is a challenge that we believe can be overcome with a collective effort, strategic action, and commitment of all stakeholders represented here today. This dialogue, therefore, provides an opportunity and platform to mobilize such efforts towards addressing the present prostate cancer challenges we face. I acknowledge the support of the development partners, including German Development Corporation, Biopharmaceuticals, for convening this National Prostate Cancer Dialogue. In line with the implementation of the National Non-Communicable Disease Policy, a strategy launched by Ministry of Health in 2022. Your dedication and resources have been very instrumental in driving the national health agenda on men's health and prostate cancer, ensuring that prostate cancer receives the necessary attention it deserves. I also want to thank our distinguished stakeholders, health professionals, policymakers, advocates, researchers, and all health sector partners gathered here today for your continued dedication to improving the health outcomes of men across the country. Our collective commitment and collaboration as stakeholders are critical to effectively addressing the underlying causes and risk factors of NCDs. The NCD policy represents a major pillar in the implementation of the NCD strategy, which is aimed at addressing the burden of NCDs in Ghana and the attainment of the Universal Health Coverage 2030 agenda targets. Acknowledging the efforts made thus far in implementing this policy, we must recognize that there is still much work to be done. Hence, today's discussion will be an important step in proposing policy recommendations, strategies, and gaps in care to help address some of the key challenges we face, which include raising public awareness about prostate cancer and the importance of early detection. I'm sorry, I almost had an omission. Secondly, expanding access to screening treatment, including treatment innovations, diagnostic equipment and drugs. Encouraging policy reforms, partnership and financing to facilitate better care and support for prostate cancer patients. I trust that the knowledge that will be shared and the recommendations from this dialogue will go a long way in shaping our national response to prostate cancer, saving more lives and ensuring that no Ghanaian man suffers in silence. By working together, we can implement comprehensive and multifaceted strategies that encompass prevention, early detection, treatment, and support for those affected by prostate cancer. It will be very important to align the interventions that will be proposed with our health sector vision and priorities in non-communicable diseases, and should be aimed at integration into the existing healthcare systems. As the ministry and its implementing agencies are concerned, that is the best approach. When development partners align their effort with our priorities, the impact indeed becomes profound and memorable. On that note, I urge all of you to capitalize on our collective expertise and collaborative partnership to help identify the gaps in care and develop strategies and interventions to address the challenges posed by prostate cancer in Ghana. Let us seize this opportunity to make a lasting impact on the health and well-being of our men, helping to receive healthy prostate and healthy populations. I thank you for your commitment to this cause. Once again, I welcome you all to this very important event, and I look forward to the fruitful discussion and outcome of today's gathering. Thank you.
Thank you very much, Dr. Osei. Right. So at this point, I would like to introduce the chairman for today's dialogue, and it's an honor. I'm so pleased to have this opportunity to do this. He is a professor of surgery. In fact, he's an academic, he's a researcher, he's a prostate cancer advocate. He is the head of departments for surgery at Kolebu Teaching Hospital and the chairman for the Ghana Association of Urological Surgeons. There is a new center of excellence in Kolebu. I'm sure most of us have actually heard or seen that building. We call it the Urology and Nephrology Center of Excellence. In fact, himself and other senior urologists pioneered, or their efforts have led to us having such a training and prostate cancer treatment center in Kolebu. Personally, I would like to say that he is my mentor. At this point, shall we all receive Professor James Edward Mensah. Thank you.
Ladies and gentlemen, I'm a surgeon, so I'll see all protocols observed. It's a privilege to chair this important national stakeholders dialogue on prostate cancer. And I would like to extend a warm welcome to you all on behalf of the Ministry of Health. Prostate cancer has emerged as a significant public health concern in Ghana. I work at Kolebu, and there is not one single week that I don't see patients die from prostate cancer. There's not one single week or day I don't counsel patients who have been diagnosed with prostate cancer. It's become a serious issue. It is the most commonly diagnosed male cancer in Ghana, and the second leading cause of male cancer death. Our dialogue today is to address this issue head-on, increasing public awareness, discussing current challenges that we face, and identifying practical, actionable solutions and policies that will improve prostate cancer care. The Lancet Commission recently issued a paper on what is ahead of us. In 2020, there were 1.5 million new cases of prostate cancer worldwide. And they estimate that by 2040, we'll have 2.9 million cases.
And unfortunately, quite a significant amount of this increase will be coming from our part of the world, low middle income countries. Our population is aging. Despite the galamsey, we are growing older. Maybe it will change. But we are aging. And these cancer incidence rises with age. This event is also a platform to update you on the progress of the prostate cancer intervention project, which is being piloted in collaboration with biopharmaceuticals, GIZ, and the Greater Accra Regional Health Directorate. We look forward to listening to their updates, hopefully including the budget for the project. Anytime I chair any function, I always want to know how much it costs to generate that data. I encourage everyone here to actively participate in today's sessions. The success of this dialogue depends on all of us, our knowledge, our experience. There is something I tell my residents all the time. Nobody is coming to help us. Nobody. We have to come together as a nation to address our problems. Some money may trickle from outside Ghana, but the box stops with us. How we effectively and efficiently utilize our resources will determine our future here. Thank you, and I look forward to a productive and insightful day of discussions. Thank you very much.
Thank you very much, Prof. Mensah. Right. There are a few other dignitaries I would like to mention briefly. We have here in attendance Mr. Labram Musa. He's the National Coordinator of the Ghana NCD Alliance. Mr. Musa, thank you very much. We have Mrs. Juliet Ejiame. She is the representative for GIZ IR. Right. Then Dr. Moses Dobache. He's the CEO of Medimosis. Mr. Dobache, shall we see you? Thank you very much for attending. Then we have Dr. Pascal Moin. He's a technical advisor, NCD, for WHO in Ghana. Thank you very much. Then Dr. Daniel Hector. He's with CHARG. Dr. Hector, thank you very much for attending. Right. So we'll quickly move to the next item on our agenda. We are
in Ghana. So I'll do so by outlining some of the key challenges and then what the health system's response has been. And then we'll see ways in which we can strengthen the healthcare system to respond more adequately to the needs of prostate cancer care. So this is my outline. I'll give a brief epidemiological overview, and then we'll look at what the health system's response has been. And then we'll look at the critical gaps and challenges in prostate cancer care. Then we'll look at what are some of the recommendations from research and people on the front line on how we can strengthen the health system to address the prostate cancer cancer that we are facing now. So, prostate cancer occurs in the prostate gland only in men. Men are the only people who have a prostate gland. So if you are a man, you have a prostate gland. And it is situated below the bladder and in front of the rectum. So you see where it is hidden. Yes, it is situated there. And then it produces the fluid that nourishes the semen. So that's briefly for prostate cancer, what prostate is. So these are some key epidemiological facts. I've decided to stick to the incidence and the mortality because we have increasing incidence and increasing mortality. So 1 in Ghanaian men above age 50 carry a risk. The risk simply means that you may have a factor that may make you more likely to develop prostate cancer. And in West Africa, we have one of the highest incidence rates. And for the age standardized incidence rates, this is because we want to be able to compare to other populations. So the global average is 29.3, but Ghana we are at 47. Standardized mortality too, we are doing around 29.2, and the global one is 15.5. So you can clearly see that we need a structured response to address prostate cancer in Ghana. So this is a graph that was plotted with a lot of data from some studies, especially cross-sectional studies. Because of lack of detailed data, I used a lot of cross-sectional studies at points in time to just show you how the cases are increasing. And they are increasing not only because the numbers are just because we are doing better with diagnostics. The diagnostic capacity and capabilities has increased. And then there are more opportunistic screening methods. So people are getting screened on Father's Day. People even present to the urologists themselves, having gone to do screening themselves because they've heard about it. So that is what is explaining the increase. No matter what the explanation is, we still need to address the increasing burden. So prostate cancer, as was said earlier, is part of a group of diseases we call non-communicable diseases. They share similar characteristics. So they have links to age, lifestyle, and genetics. And I think from research, prostate cancer is one of the cancers that really shows genetic preponderance, which means that if you have a first-degree relative, you are more likely to get prostate cancer. And then they also require long-term management and care. So a lot of people are parading a one-time cure for non-communicable diseases, but these diseases show that they need regular treatments and ongoing care. So you may need to book more appointments with your doctor, you may need to visit more regularly, and that is also a big challenge to people because they wish they could just go once and they will not go again. And then there's also a lot of late diagnosis and delayed care. Some are from the system and some are from the individuals. They ignore their symptoms till it's worse and they can't do anything about it. And then there's always a problem with access to specialized care. There are always urban-rural disparities, and then the trained professionals are almost always centered in urban areas. So it's very difficult for rural folks to get access to it. So that's what contributes to the increasing numbers of the non-communicable diseases we are seeing. Examples of non-communicable diseases are hypertension and diabetes. And then the financial burden, as I said, you need to be visiting the hospital more often. So if you don't have any form of financial risk protection, you have to spend out of pocket at every visit. And this can also be a disincentive for you to stop visiting and look for alternative homeopathic cures, which are sometimes dangerous and unsubstantiated. So we'll look at what the Ghana's healthcare system response has been. And the healthcare is supposed to be institutions, people, and resources that is designed to deliver healthcare services to the population. So the main aim of the healthcare system is to ensure that the population has improved health, and then they do not suffer financial risk when they approach the healthcare system. You don't have to lose all your money just because you want to be cured or you have a disease. These are the building blocks of the healthcare system. We have leadership and governance, which makes sure that there's political commitment to health activities. We have healthcare financing, like the NHIs, which ensures that people do not pay out of pocket at the point of service, so that there's no barrier to seeking care. And then we have the health workforce, where we make sure that there are adequate numbers of essential trained healthcare workers to take care of the population. And then we have our medicines, we have information and research, and then the service delivery as well. You shouldn't be disadvantaged because you are living in a rural area. There should be some form of service available for you. So what has the health system response been so far? So it's been in terms of policy.
All right. Please, we are honored to have in our midst the Deputy Minister of Health. Shall we all rise as we receive her into the auditorium? Very well. Thank you very much.
So a very warm welcome, madam. So what has been the health system response? So we have a national health policy, which is a whole of population, whole of government approach to ensuring that the population is healthy. And this policy also addresses the social determinants of health. So it looks at all the facts, the other sectors that have an influence on health. And then we have the NCD policy and strategy. This has 6 broad objectives, which is trying to solve some of the risk factors that expose us to non-communicable diseases. And then we have a national cancer control plan. So this details what the government and the country wants to do with cancers. It is not specific for prostate cancer. It's a national cancer plan. And then we have risk factor control policies, because as I said, these diseases are similar and they have similar risk factors. So there are policies that address these risk factors. And Ghana is a signatory to the Framework Convention on Tobacco Control. So we have a tobacco control policy, and then we have alcohol policy, and then we have elimination of trans fatty acids in our diet, because we know some of these diseases are lifestyle related. So there are policies that are tackling these risk factors. We also have our physical activity guidelines, because we know lack of physical activity is also a risk factor for developing non-communicable diseases. So we have a physical activity guidelines. So these are guidelines that are aimed at controlling the risk factors that will make us more likely to develop any NCD, including prostate cancer. Yes, so these are the policies that I spoke about. The first one is the National Health Policy, and then the very comprehensive, recently launched non-communicable disease policy, and then we have the Essential Health Service Package policy. So these are all government commitments to ensure that no matter what illness you have, especially in terms of non-communicable disease, there is an intention, there's a plan that guides how we can go about it, right from prevention to palliation. And as I'm going through, you can see that these are non-specific for prostate cancer. Prostate cancer is mentioned in them because they are parts of it, but it's not a separate document for prostate cancer. Unfortunately, our National Cancer Control Plan has expired, which will be revised soon. So I think it will also be a brilliant opportunity for us to make good inputs into the new cancer control plan to spell out the details of what we want to do with prostate cancer control in Ghana. And then Ghana also has a promise to keep. We are working towards universal coverage. And the tagline is, we are leaving no one behind in terms of healthcare. So it doesn't matter where you are and what you can afford. We need to be able to make sure that you don't suffer financial risk when you approach the healthcare system. So these are all government commitments and the health system's commitments to ensure that if you have, let's say, prostate cancer, these are some of the commitments the government has made towards providing for your care. So I just want us to have a look at the prostate cancer treatment infrastructure. This will inform later slides we'll have a look at. So apart from Swedish Ghana Medical Center, all the rest are public hospitals, public-based hospitals. And I want to add that Kolebu is the only institution that does brachytherapy as well. The only institution in Ghana that provides brachytherapy treatment. So you can imagine the bottlenecks that will be created if we have to refer all patients from Ghana who need brachytherapy to Kolebu Teaching Hospital. So this is just to show you that the services across the public health services are not exhaustive in all. Some provide some form of services. So some provide surgeries only, some provide both surgery, chemotherapy, and radiotherapy, and some do just radiotherapy. But I hear if you happen to have a urologist in your center, maybe you can do some surgeries. So what are the key challenges facing prostate cancer care in Ghana? The first one is late diagnosis. We all know the old adage, a stitch in time saves nine. If you catch things early, you are able to work on them well. The main problem is late diagnosis, which ultimately means poor outcomes or poor prognosis. And this is even a lower figure because some studies have even put it to 80%. So about 60% of men with prostate cancer in Ghana present with advanced disease, when the disease is advanced or it has spread beyond the prostate, yes. So it's a very serious issue, about 60%. And then 58.3% of men in Ghana have little to no awareness of prostate cancer. Sometimes I think because of where the prostate is hidden, we forget that we have a prostate. But yes, the 58.3%, they have little to no awareness. And we all know if you are not aware of a particular, if you look at the social belief model, if you are not aware of something and it's not a threat to you, you may not seek help for it. And then limited access to screening. Fewer than 20% of men above the age of 50 in Ghana have undergone PSA screening. So if you are a man in this room and you fall in this category and you've not had a PSA screening, you are part of the statistic. Fewer than 20%. Fewer than 20%. And the sad thing too is that even with those who have the knowledge to undergo the screening, they do not present because there are lots of barriers, which we'll talk about, the socio-cultural factors. So there is also the problem of NHIS coverage. The treatment is not covered by the NHIS. So it's a significant challenge and a significant barrier. And then the socio-cultural factors, the myths and misconceptions about prostate cancer is very rife in Ghana. It's very, very rife. And I think of all the factors, it's the most contextually relevant one we need to deal with because there are so many myths and misconceptions surrounding prostate cancer in Ghana. And people who even have the information on prostate cancer, they don't have the correct information. So I'm sure if you are a man and above 40 in Ghana, you would have heard a friend recommend eating cassava or soursop for prostate health. I'm sure we've all heard, yes. So we want to know if it's fact or fiction. We want to know why, because of that, the price of soursop has gone up. You cannot buy it. It's now 60, 70, 80 per fruit. So maybe today the professors will tell us if there's any substantiated claim in this. But this is what people know about prostate. The general populace, they think once you are taking enough cassava or soursop, you don't need to get screened. It will automatically show. People have demonstrated personally that they took cassava and then their prostate shrunk. So it is something that is left for research to provide us. So now we are moving on to how we can strengthen this health system to be more responsive to prostate cancer. So we are going to look at leadership and governance. I previously said that we need political and government commitment to prioritize prostate cancer in our health policies. I started with the health policy and I said they are very general, but if you want to be specific, we need to tailor some of these policies to address the specific needs of prostate cancer as part of male reproductive health, because that is one of the greatest barriers to receiving care for men. Perceptions of masculinity in Ghana and how we view the screening process. When you tell someone you want to do a digital rectal exam, they will tell you want to do what? It's just not acceptable for men. We don't like that. We are not used to intimate examinations like women are. So it's very difficult for someone to approach for screening. So we need the government and the healthcare system to fully integrate prostate cancer into national policies, because this will mean that they have intentions to solve it, and then there's political commitment and political will to do it. So we need also, how can we strengthen it? We need a comprehensive prostate cancer control framework. So this framework should include a cancer control plan that is specific for prostate. They also need guidelines that the government, treatment guidelines specific for our country context that the government will commit to. And then we also need to make sure that there's a lot of integration with other allied services like mental health support and health promotion. So right now, the situation with service delivery is that services are limited from prevention to palliative care. Some studies have shown that even when people attend a hospital, they don't get enough information on getting screened for prostate cancer. I think now we only hear about prostate in men during Father's Day. After Father's Day, that's all. But I think the advocacy and the awareness should be attached to everyday service delivery. And then how can we strengthen service delivery? We have to expand primary health care to include PSC tests. We have a well-structured primary health care. So our primary health care can take up some of these low-hanging fruits and do it. Health promotion is here. They can tailor and disseminate prostate cancer information, because you realize that if you go into the community or if you interact with a lot of people, the myths and misconceptions and even treatments concerning prostate cancer is very, very rife, and we need to address that through well-focused health promotion messages. And then we also have to strengthen care linkages through multidisciplinary teams. Prof. Chair was talking about having to counsel people. We need to be able to provide mental health services for people who need it, because to be told you have prostate cancer and to be told you be presented at the next stage is very difficult. That's where people tend to go to all sorts of people who provide alternative and sometimes harmful care. So it's very important that there are linkages to other services like mental health care services. And then the health workforce, there's a shortage of oncologists. I think I don't know the number in the country, but they are not enough, and they are centered in the urban areas. And yes, we may not have enough to go around, but we can structure it in such a way that we can do a lot of task shifting. We can do a lot of task shifting, and we can also do some incentivize them, and then we can also do outreaches as part of strengthening the health workforce. And then the health information system is a very critical part of prostate cancer care. We need the data. We need data to inform decisions. We need the data for planning. The NHS, we need data to show that they will be investing, their investment in prostate cancer treatment will be of benefit to them. So we need to provide good and adequate data. And the data we have right now are usually population-based. So we need the national cancer control plan, and we have to improve data collection at the community level as well, and also as part of our national health reporting systems. So with access to essential medicines and technology. So the medicines are available sometimes, but they are not equitably distributed and they are not affordable for everyone. So we need to work to ensure that the medicines used for treatment are also available, and then they are affordable, and then we also have to do partnerships, strategic partnerships, to ensure that the private sector also provides some form of support to support medicines and technology in terms of prostate cancer care. So health financing. The NHI is here, so I know they will talk a lot about it more, but I want to say that it's one of the main barriers. It's one of the main barriers to receiving care. The high cost of treatment for patients. The high cost of treatment for patients. And I have experienced that personally because I have a relative with that. And I must tell you that it is not very, very easy if you do not have that form of, if you don't have the financial wherewithal. And also, the painful aspect is that people will quickly, because there are lots of homeopathic remedies available, people will quickly leave you and go elsewhere. And some of these treatments, as I've said, are dangerous. Our experts have not substantiated it, but people are providing it. So we need a lot of investment in making sure that prostate cancer patients do not suffer financial harm or financial hardships when they have to be treated. So if you look across our healthcare system, there are a lot of integrative opportunities that we can ride on to make sure that some of these low-hanging fruits are solved. For example, we have a structured health service. There are promotive parts, preventive, curative parts. So as I said earlier on, we can start with health promotion because we realize that awareness is very low. So we can work in partnership with health promotion to make sure that there are tailored country-specific messages for prostate health in Ghana, taking into cognizance that our men have a lot of beliefs and personal barriers that prevent them from receiving care. And then we also have to integrate the screening into wellness clinics and routine screening programs. The Ghana Health Service has a lot of wellness clinics, and we do check basic BMI or blood pressures, etc. So if a man walks in that race category, we should be able to counsel the man and then provide a form of screening for that. So these are already structures that we can use. And then the NHI too has recently launched a scheme where they will call people yearly on your birthday for screening. We can add that screening for men 50 years and above as a form of measure. And then there are lots of technologies that we can use for data and patient monitoring. They are already in the system. We can piggyback on some of them. We don't need to form new structures. We can ride on some of these existing structures. So there is also the network of practice and care linkage. We can also rely on that. It's a new concept which is promising to deliver care to rural population. We can piggyback on that because it has components of telemedicine, etc. So this is an opportunity for the healthcare system to also integrate into the network of practice. And then we can also explore task shifting to primary healthcare workers. We've done that for childhood cancers. So when patients receive treatment from the comprehensive treatment centers and they go back to their communities, they don't need to come back to the treatment centers for like transfusions, etc. There should be a supportive treatment document that will tell those at the lower levels how to help people so they don't have to come back to the already congested major treatment centers. We can do that for prostate cancer as well. And then collaborations. Collaborations are very important with private sector partners and partners in health. So, in summary, I can say that we have made some notable progress, but there are still challenges. And I want us to know that these challenges are not insurmountable. There are things we can do something about. The challenges remain in coverage and access. So we can strengthen the healthcare system through increased collaboration. This is what has resulted in collaboration with GIZ we are seeing today, the first national prostate cancer dialogue, which I hope the ministry will take up and will have the events annually. Of our cases importantly. So if we build capacity, especially at the primary health care, to improve detection and treatment, we will reduce our numbers, we will reduce our morbidity and mortality. Thank you.
Thank you, Dr. Olelu. Right. So there are many conditions that affect the prostate gland, not just cancer. There is BPH, there is tuberculosis of the prostate, stones in the prostate, infections in the prostate. So today, the emphasis is on cancer. So the cassava and all these other things that I'm talking about. Maybe Professor Mensah will address them. find that the cancer care plan for Ghana is expired. That's pretty much unfortunate because of childhood cancers, breast cancer, liver cancer, prostate cancer, all kinds of cancers. I think that this dialogue is important. Maybe we should address that cancer care plan importantly. All right, the total number of urologists in Ghana, definitely less than 100. And we are 30-something million people in Ghana. We are less than 100 urologists in Ghana. In fact, including those who are still in training. And when it comes to oncologists, they are probably less than 40 across the entire country. These are very, very important things we need to address. Okay, I would like to use the opportunity to introduce some important dignitaries in our midst. I'll start with the Director General of the Ghana Health Service. Please help us welcome Dr. Patrick Kumagwaji. Thank you very much, sir. Very well. And then we have the Cluster Coordinator for Sustainable Economic Development, Mr. William Ugo. Thank you very much, Mr. Ugo. Right, and then importantly, we have the Honorable Minister of Health. She's an MP. Honorable Deputy Minister of Health. Yes, so Honorable Adelaide Intin. Thank you very much for coming. All right, so the next on our agenda, we are going to receive remarks by the Ghana Health Service. The presenter will look at the outlook of prostate cancer in Ghana, including epidemiology, risk factors, and advancements in treatments. Please let's welcome Dr. Patrick Kumagwaji. He's the Director General of Ghana Health Service to deliver this keynote presentation. Thank you.
Thank you very much and good morning. My Deputy Program Manager has said a lot of the things in my listen. I think for emphasis it will be very important that we go through this. Chairman, distinguished invited guests, the media, ladies and gentlemen, I think before I start my speech, this is a very, very important assignment, and I've been to several meetings with NHIA trying to push, and I hope this will be a bigger push to really get that. A lot of the time, the issues of men seem to be neglected because we go around being machoistic, but we are also very, very frail. So I hope this will be a catalyst for better things to come. I'm looking at the strategic position person here who will purchase the prostate cancer management, and she's here. It is an honor to have the opportunity once more to join this dialogue, national dialogue, on a disease that threatens survival and well-being of the male gender, that's prostate cancer. Predicting and ascending incidence. So the challenge is quite huge, and we must really address this. Sadly, 1 out of every 3 men aged 40 years and above is at the risk of prostate cancer. Leading cause of cancer death among men and require concerted national and subnational effort to address them. Distinguished ladies and gentlemen, the risk factors associated with prostate cancer, I'm sure, have been highlighted, such as increasing age, like us, family history of condition, race, ethnicity, obesity, and diet abound in our communities and our daily lives, putting almost all of us, as men, at risk. This is also coupled with the fact that while the clinical treatment management of prostate cancer in the country until recently been tertiary and secondary levels, where diagnosis is mainly done through history, abnormal prostate-specific antigen, digital rectal examination by biopsy. To change this trajectory and improve access to prostate cancer services, service providers such as the Ghana Health and the teaching hospitals have begun tilting the balance towards prevention and early detection. At the policy level, the revised National Health and NCD policy priorities prostate cancer, emphasizing awareness creation and adoption of healthy lifestyle, while the prostate cancer guidelines have been developed to ensure prostate cancer care is standardized across the country. Ladies and gentlemen, regarding our men who are nowhere near secondary